Hello, it's my job to welcome you to today's virtual members event of the Liverpool University Hospitals NHS Foundation Trust, LUHFT, LUFT as we tend to call it. Our subject today is clinical research, and I shall be introducing the speaker in a moment. First, let me briefly introduce myself. I'm Kemp. I'm a medical professor at the University of Liverpool, where I lead one of the research departments. I'm speaking to you today as one of the Trust's appointed governors, whose role is to represent and be a link with key local partners of the Trust. I'm the appointed governor for the University of Liverpool. LUFT and the University of Liverpool work very closely together, first as fellow members of Liverpool Health Partners, whose mission is to unify the clinical and academic strengths in health across the Cheshire and Merseyside area. Second, because many LUFT staff have honorary contracts with the Trust, with the university, and vice versa, so that university staff help deliver clinical care, and LUFT staff are directly involved in research in partnership with the university. And lastly, in the training of our medical, dental and other clinical students. What does the University of Liverpool appointed governor do? As well as some particular responsibilities to foster that partnership, I have all the normal responsibilities of a member of the Council of Governors. So we help to ensure the Trust provides the highest quality services for patients. We work with the Board of Directors to influence the Trust's future plans, and we ensure that the voice of members and partners informs LUFT's decision making. Becoming a member of the Trust is a way of contributing your views to your local health service and accessing exclusive member benefits like this session. There will be information about how to become a member in the Q&A section throughout this event and shared at the end of the presentation. So today's topic is clinical research. Given its importance to the Trust and the university and to all of us, I'm delighted to introduce my University of Liverpool colleague Terry Jones, Professor of Head and Neck Surgery. Today, Terry will be speaking in his key role as Director of Research and Innovation at LUFT. Over to you, Terry.
Thanks very much, Graham, and thank you for the introduction and for the invitation to speak. Can I just check that you can see that in presentation mode on the screen? Brilliant. So as Graham says, I'm a Professor of Head and Neck Surgery based at the university, but in January 2001, I took over as Director of Research and Innovation for LUFT. And as you'll see, that's is a potentially exciting role with lots of ambition from the Trust. So I'm going to talk to you today about the importance of research to the Trust. And that's both within the Trust itself, but as also as the Trust as a leader in the local clinical research infrastructure in our local system. So I guess one of the first places to start is why might we want to do a huge amount of research? And the first place to start is to understand that Liverpool, population of about 900,000 people, is the largest urban area in Cheshire and Merseyside, and actually, and unfortunately, many people within that population are economically disadvantaged and therefore at higher risk of poor health. That's both higher risk of contracting or developing poor health, and also succumbing or having the ill effects of poor health. There was a term coined by Professor Louise Kenny, who is the Executive Pro-Vice Chancellor of the University of Liverpool. And she coined this phrase, which I think is hugely powerful, is that we in the university and healthcare sector have a civic and moral responsibility to deliver healthcare research to address this imbalance that I just spoke to you about, particularly in health inequality, and to focus research which addresses the greatest health needs of our local population. For any research to be meaningful, it should be excellent, and we shouldn't shy away from that. Research that makes a difference is by definition excellent, and it needs to be excellent to attract funding for in a highly competitive national and international funding environment. I think it's also important for us to understand where we position our research endeavours. So, as many of you might know, the southeast of the country is referred often as the golden triangle of research, and that involves Oxford and Cambridge and some of the bigger London centres. And lots of research funding is disproportionately allocated to that golden triangle. However, whilst the Golden Triangle centres are extremely good at doing what they do, the bits that they are unable to provide is actually needy in healthcare terms populations. And therefore, we in Liverpool, it seems entirely reasonable that we position ourselves in the space of what we call translational research. So this is research that could be laboratory based, doesn't have to be laboratory based, but it's designed to be very quickly into patients. So that's another term for it is bench to bedside research. You can do whatever you like in the laboratory, but that needs to be turned into bedside care as soon as practically possible. And that could be to deliver personalized medicines. It could be high quality quantitative or clinical studies. It's a whole range of research that we can do in this space. I think one of the exciting things for me in Liverpool at the moment is obviously the creation of LUFT with the merger of the pre-existing Royal Liverpool and Aintree hospitals, the location of Clatterbridge Cancer Centre into the centre of town adjacent to the new Royal building, the formation of Liverpool Health Partners that Graham alluded to, and I'll come back to that, the endeavours of the clinical research the Clinical Research Network in the Northwest Coast. So this is an organisation that's funded by the National Institute of Health Research, and it's centrally funded, and that allows us to provide research delivery staff, so that's nurses and other staff that are required to deliver research, and that makes the NHS probably unique in the world as a place to deliver healthcare research. And we need to understand the benefits of that, and actually not to squander that research, because we are in a unique place internationally, having that facility on our doorstep. So all of this conspires to be a really ideal time to develop system-wide integrated research strategies in Liverpool, and to actually think about an aim, which I'm sure we would all share, for Liverpool to become a national leader in healthcare research. One of the things that persuaded me to take the job, to switch from my previous job to take on the job as Research and Innovation Director, is the fact that the LUFT had, the Trust Board of LUFT had set a corporate strategy that included great research and innovation as one of the 4 pillars of their corporate strategy. I've made the case since that, accepting my bias, that great research and innovation actually underpins the other 3. So we need to start thinking of great research as underpinning great quality of care. And if we get the research and the quality of care right, then that allows us to be ambitious and will attract great people to our organisation. So again, accepting my bias, research and innovation is critical to the endeavours of the organisation. So it's not just our idea. The context of this in NHS terms, as per this publication in 2001, was to create a patient-centred, pro-innovation, digitally enabled clinical research environment which empowers everyone across the NHS to participate in delivering research that ensures that patients from across the UK are supported to take part in research that's of relevance to them. And that white paper highlights 5 key themes, which you can read for yourself there, all of which are embedded in our own research and innovation strategy, which we've developed for the organisation. This is what it looks like, and it's public available, so if anybody wants a copy, please just ask. So in that strategy that we wrote, we've defined our ambition, and our ambition is for LUFT to achieve and maintain a position in the upper quartile of research active NHS organisations, benchmarked against similar large research active trusts, so that would be the Sheffields and the Leeds and the Newcastles of the world, and to collaborate with our university partners to develop a balanced research portfolio of cutting edge clinical and translational applied research and innovation, and that's important to realise, which will actually deliver the healthcare and societal benefits of our local population. And actually, this is designed to capitalise and expand on the outstanding research performance of the trust and the system in the COVID-19 pandemic. Collaboration was key to that, and flexibility, working with other local NHS trusts. We happen to have a fragmented healthcare system in Liverpool, which has its benefits, but also has its downsides, and that's why collaboration is so key. We need to work with Northwest Coast and other universities to make sure that we can capitalize on what we aspire to do. We had 3 aims as part of our strategy. The first was to maximize recruitment to our clinical trials. That again requires collaboration. It requires embedding a culture of research and innovation throughout the trust. That was probably missing in the 2 organizations before the merger. So it's really important that we actually develop that culture and we all understand it. And that we need to grow capacity and capability to deliver research. And that will allow us to expand the critical mass of what we call principal investigators. These are the jobbing clinicians who will simply recruit to clinical trials, often other people's clinical trials. The second aim of this, which is a little bit more ambitious, is to understand and develop our own areas of academic strength, for us to work with others, particularly the universities in the system, to develop areas of academic research that can actually compete with other high-profile research groups nationally and internationally. And these will actually increase the number of chief investigators. These are the people who, like me and Graham, are paid to do research for a living and develop our own research ideas for external funding. And actually, there's a great correlation to suggest that research outcomes, and therefore healthcare outcomes, are correlated very strongly with the number of chief investigators that you have in your region. And then also, LUFT needs to be a leader in a One Liverpool healthcare research agenda. We set ourselves some punitive targets about high quality research and innovation, widening access to research and embedding the culture. And we've set ourselves as, and this is the organogram to explain how we manage the research and innovation within the trust. It's all relating to a research and innovation steering group, which I chair monthly, into which all the important parts of research feed, going back up to the Research and Innovation Committee, which is at the board level. So how have we been doing? So the first thing we needed to do for progress, to progress aim 1, was to develop an agile research delivery workforce so that research delivery nurses were allocated according to the workload that was derived for that specialty. So if you had lots and lots of clinical trials that you needed to do as part of that specialty, you got more research nurses allocated within the trust, and that didn't exist before. We've embedded senior research delivery staff into the clinical delivery structures of the trust, and that's important because for this to succeed, research has to become part and parcel of routine clinical care. We have developed research and innovation leads throughout the specialties, and that comes back to the point of developing principal investigators. And what we've also needed to do is develop research leads in the nursing and allied health professional field. So that's speech and language therapists, dietitians, physiotherapists. This is actually quite an easy win because there's lots of people in these areas who are desperate to become involved in research. We've done some deep dives into various aspects of our research delivery pathway so that we can understand some blocks in the system and how that might require reallocation of resources. And we need to develop a business function so that we can become proactive. We managed to hit 2 out of 3 of our first year KPIs, and we will hit our 3rd very soon. The 3rd relates to widening access to research and allows us to make it patients aware that when they contact the trust, that they will be it will be made aware to them that this is a research organisation, that they're likely to be approached about research, and if they're not approached for research, that they should approach the clinicians to ask what research is available for them. Aim 2 is a success story up to now. This is the one of identifying areas of high impact. So the NIHR, once again, that centrally funded body, funded a clinical research facility, which is hosted by LUFT, that now includes Clatterbridge, the Heart and Chest Hospital, and the Walton Centre. And that succeeded in accruing £5.3 million of funding for research to be delivered between 2022 and 2027, and that funding increased from £1.3 million in the previous round. That's a real flagship for the organisation and for the system as a whole. Added to that, there's been further success of £3.6 million of an agile platform of research, which was integral to the development of new drugs involved in treating COVID, and that's been taken over by Liverpool in the form of Professor Sekou from Southampton. There are some challenges coming up. We're moving to a massive new 26-bedded unit in the new hospital, which is great, but it means that we have to have a business plan that copes with that to ensure that all of that facility is correctly used. And we need to be able to develop our collaborations with industry to ensure that. We need to identify these areas of research excellence, and that's not as simple as you might think. If we look at some of the data that are available, it only gives us a snapshot of what might be relevant. And so we need to think about this in a different way. We need to look at emerging research strengths, and my plan is, once we get some data together, to have an external review of that. Professor Robert Sutton and Professor Joe Patterson have put together a fantastic clinical investigator development project, which dovetails with a similar project that's run by the Northwest Coast Clinical Research Network to develop future clinical investigators. That's hugely important for us to develop our strategy going forward. We need more clinical academic workforce planning, how we embed research into clinical job planning, for example, and how we really embed this culture within the organization, right the way through from top to bottom. And we need to think about how we can develop our leadership role in a system-wide approach. Importantly, we have done sterling work in closing the gap financially. The trust paid £10.5 million to take the research nursing salaries onto the books of the trust. We needed to bring in enough research money to close the gap, or at least to pay for it, pay for that money back. And our plan is, and we're well on track to do this, is to break even by the end of year 3. So this is the way we see research and innovation in the organization developing. If you take the left-hand side of this slide, this is what we will do internally around the aims that I just described to you. But externally, our work will be with Liverpool Health Partners, and how we work with our other partners in both universities and NHS trusts in the region, in the wider region, that's on Liverpool or Cheshire and Merseyside, and how we facilitate, because we are so big in the system, delivery of life-changing research across the whole system, not just within our 4 doors. So that was a little whistle-stop tour of what we're doing, because time was short, but essentially, as I've said to you before, it's really important for patients to understand that we're now a really research-active university hospital, that we aim to offer research opportunities to all our patients, and that if they're not, then patients should contact us to ask how they can become involved in research. Asked to put this slide up by the corporate governance team, and thank them for inviting me to speak to them today. And if anybody would like to join as a member of the organisation, please read this slide. You've got the contact points there, both emails and telephone numbers, and your presence would be your presence and interest would be gratefully received. I've whizzed through that in light of the fact that this is a relatively short presentation time, but it also gives us time for questions and answers afterwards. Joined on the call today with my friend and colleague Jules West, who is the Chief Operating Officer, is the Assistant Director of Research, who actually operationalizes much of this strategy that I've talked to you about today. So if you have any questions for either Jules or I, would be only too happy to take those for you. I'll stop sharing these slides now.
Hi Terry, we've received 7 questions. Can you see them on your screen?
Just bear with me. Okay, questions and answers on just getting this up now. I've got 8 actually. So the first one that's come through, which I'll, can you hear me okay? Is what organizations are involved in clinical trials and Luft. So I think the best way to answer this question is that Luft as an organization as a whole is involved in clinical trials, together with Northwest Coast Clinical Research Network that I actually described to you. So the way this actually works is that clinical trials are designed by often clinicians or academics who put, or industry partners who put clinical trials to test new medicines together, and that they will actually be delivered as part of a research and innovation structure within the organization that Jules runs and I will run. So research will involve all of the clinical specialties within the trust, as well as the supporting organizations such as the pathology labs, radiology, pharmacy. And it's actually a real industry that's required to put clinical trials together to make sure that the regulations are correct, that everything's, all the T's are crossed and the I's are dotted, and that clinical trials are run safely. So part of this is having a huge governance structure to make sure that we're running clinical trials. So the answer is that there are multiple organizations, but they're all encompassed within the Luft banner, if you like, and within the system. So the second question is, what are the different types of clinical trials? So there are essentially, the easiest way to think of this is that there are 3 types of clinical trials, and they're called, defined as phases. So you go through phase 1, phase 2, and phase 3. Now, phase 1 trials are the trials that would be delivered in the clinical research facility that I spoke to you about, the one that's got £5.3 million. And these are typically early, well, by definition, early phase trials. So these would, when a drug would be first tested in humans, for example, or vaccines might be first tested in humans, or it might be, and essentially these trials are designed not to show that the drug is effective, but it's likely to be safe. Phase 2 trials are a little bit of an interim. They often ask the same questions as phase 1 trials around safety, but they start trying to tease out measures of effectiveness of the drug, for example. And then phase 3 trials are the ones where you get direct comparison of the trial versus a standard treatment, the drug versus a standard treatment. And it's that trial that actually will give you the signals to suggest that that drug not only is safe, but is effective. And then it goes into clinical trials. The next question is will my personal details be shared in the public domain or published in a paper? And the answer to that is no. There's rigorous governance about all of this. Whenever anybody gets involved in a clinical trial, they will have to sign a consent form, or they will be invited to sign a consent form. And the consent form will specify exactly how their data as part of the trial will be used. The vast majority of trials are truly anonymized as things goes on. And as for being published in a paper, that will not happen because a lot of paper publications of the trial afterwards are just not able to, just don't get down to the individual patient detail. So the answer to that is no. If there is a specific case where personal details might be shared, that would not happen without patient's permission being asked and sought or secured. And Jules has already answered that tonight. This list is, so thank you for the opportunity to learn about the clinical research such as a member. What more can we do to help the trust with its work in this with its work in this area? I might actually ask Graham to deal with that question, or Daniel.
My suggestion would be getting the message out there, I think, among your friends, colleagues, and all the networks you're part of. Opportunities to participate in trials are usually advertised in various ways, and we always welcome help with that. But I don't think that this area of the Trust's work is as widely understood as it should be, and obviously this meeting is part of that. So It's a slightly vague answer, isn't it? But just, make use of your networks to get the message out there, I think.
Thanks, Graham. So the next question I have on my screen is that I assume the move of funding outside of the southern-based triangle is part of the government's agenda to level up the UK. Is Luft and its partners getting the right level of support from the local MPs? And I think the answer to that is yes and yes. I think what we've actually got is structures that are probably only partially successful to have that levelling up agenda in the current parlance. There are things called the Northern Health Science Alliance, of which we are part of, that is specifically designed as part of Northern powerhouse politics to redress the balance between North and South. The structures that have been set up in Liverpool, of which Luft is a leader around Liverpool Health Partners, is also specifically designed to redress the balance of that geographical difference. And actually, to my mind, and certainly the MPs that I've had pleasure to speak to, are all highly supportive in this sphere. Whether the policies are truly successful, I suspect the answer to that question is no, and that we need to keep pushing on this to continue to redress that balance. But it's only by developing strategies that I've just described to you that work with others will we actually achieve that outcome. Next question is, what are the benefits of participating in a clinical trial? So let me just broaden that out a little bit. So one of the real questions is, why bother to do research? Why bother to do clinical trials? But it comes back to what I tried to explain as I was going through my presentation, is that there is now lots and lots of data to suggest that healthcare organizations or hospitals trusts that do lots and lots of research, high volume research outputs, have better clinical outcomes, irrespective of what the trial is trying to answer. And the reason for that is perhaps a little bit counterintuitive to start with, but it actually is lots of little things. It means patients will get access to new drugs quicker, potentially as part of a clinical trial, but actually just the way clinical trials are organized and patients have treatment in terms of regimented follow-up, really close follow-up and monitoring throughout the trial undoubtedly impacts on their outcome for the disease treatment that they're having. So on a macro scale, as to why patients should get involved in clinical trials, that's a compelling yes. A little bit more nuanced than that is the benefit to individual trials, to individual patients. And often the case is unestablished. The reason you're doing the trial is that you don't know whether the treatment that's being trialed or the experiment is actually of benefit. And I'm always gobsmacked, in part of my other job, is how patients are so willing to sign up for clinical trials to allow that, because there will be cases that the patient who's signing up to the clinical trial will have no benefit from the clinical trial, and that the benefit will accrue to the patients who have similar disease coming down the track. For that, I will always be eternally grateful to any patient who signs up for a clinical trial. The next, and I think it's the last question, is it says, great to learn about the progress being made. Is there any evidence of this helping with recruitment or retention in the trust? So the answer is, in the system as a whole, the answer is yes. So we are now beginning to attract some high profile researchers into our organization, into the system as a whole. And they're being attracted because of the research infrastructure that we're putting in place across the system. So I think that's early days. We need to do an awful lot more work, and one of the central tenets of our strategy is to do exactly that. But there is evidence that that's actually beginning to work. Daniel, I'm anticipating that the time is coming to an end, and I don't think there are any more questions. Over to you, I guess. Graham.
Thank you very much for attending this virtual session. And thank you to Terry for hosting it as well.
Thank you.
You're very welcome. You're very welcome. Any questions, please get in touch.